All right, so Miss Teresa and I have worked a lot together since I've been in this position. We've had a lot of fun, and I'm really happy that she, well, I kind of volunteered her, but she actually volunteered to help us out today. She's a proud Utah native. She lived most of her life in Sandy and currently lives in Lehigh. She drives a long way. She graduated from Weber State with an associate's degree in nursing, served an LDS mission, and I can't pronounce that, sorry, it's in Honduras. She's used her Spanish repeatedly working as a bedside nurse in the emergency department. She earned her bachelor's degree from BYU. I'm guessing that's BYU, Idaho, and in 2017, earned her master's degree in nursing education from Weber State. She loves nursing and has spent most of her career using her heart and hands, call those skills, to help patients in often their most vulnerable moments. She has been the injury prevention and trauma outreach coordinator for trauma services at Intermountain Medical Center since April 2019. She loves the challenges of this position. She works alongside a great group of surgeons, advanced practice providers, trauma program manager, process improvement coordinators, and registrars. Loves anything that allows her to educate the community on injury prevention, and falls prevention is a big part of her passion. She also loves reaching out and educating her EMS providers. She is married and has 4 children, 2 beautiful daughters that are both nurses, 2 handsome sons, and 1 son-in-law. In 2016, she received her crowning glory and became a grandma. And we get to see some of those pictures if she's still logged in of her grandkids. Since that time, she's earned the title 2 more times for a grand total of 3 of the most adorable little boys that she loves kissing and spoiling. She plays the piano, collects foreign coins, and loves to read. So we welcome Teresa. And then we have Sally. Sally's a physical therapist who has specialized in orthopedics and falls prevention. She and her husband own a PT clinic in Washington State for 12 years. After receiving her MPH in 2014, she has worked at the Oregon and Utah State Health Departments implementing Stepping On, an Otago exercise program. Sally and Senator Iwamoto started the Falls Prevention Alliance in 2017. Currently, she is working on a CCTS grant with the University of Utah, Salt Lake City EMS, Gold Cross, and other stakeholders to reduce repeat 911 calls for older adult falls. She volunteers at the Maliha Free Clinic, providing physical therapy services for people who don't have health insurance. Loves interacting with clients, most of whom are refugees, and being able to provide therapy for people who cannot afford it. She has 2 sons, one living in Colorado and the other in Wisconsin. She enjoys the outdoors, likes to hike, bike, row, and cross-country ski. So welcome, Sally. And we welcome both of you to us. I don't know which one of you has decided to go first.
That would be
but yeah, just letting you guys know, go ahead and share your screen whenever you're ready. And we look forward to your presentation.
Thank you, Jamie. I have stewed and stressed all night to make sure that this technology goes okay for me. So here we go. I am going to share this screen. I told Jamie that I logged into my own view so that I didn't have to ask, can you see my screen? So again, thank you, Jamie, for the invitation to come out and share this information with you today. Where most of us involved in emergency room nursing and ground level falls are not as cool as the other trauma patients that we see, but unfortunately they are very prevalent in our emergency rooms. So I'm open to questions. If things don't make sense, please ask me, or I'll look forward to any questions that you have at the end of the presentation. So for many of you, you might remember this advertisement that aired in 1987. I'm sorry, but I have to play it. Oh, hang on. I just realized at the bottom of the screen, see, I said I was going to make sure share sound and video. Okay. Okay, bear with me while I get caught back up here. Have to have the sound with this one.
Ill, I was able to summon an ambulance, my next door neighbor, my family, and my doctor without picking up a telephone. I used this.
Okay, hold on. See, that's why I said I was going to take a deep breath and not panic here. Hold on 1 second. Okay. I'm going to have a degree in some sort of marketing or something
remote
after I'm done.
control to
Okay.
contact Life Call, my 24-hour
Are you able
emergency
to hear that?
medical response service.
Yes.
Watch. You
Okay.
just press this button and speak into the air and
I'm having chest pain.
I'm calling paramedics and your family, Mr. Miller.
I've fallen and I can't get up.
We're sending help immediately, Mrs. Fletcher.
see, protect yourself with Life Call and you're never alone. To get complete free information by mail about this affordable medical emergency response system, call toll-free now.
Okay. So, for those of you who remember the advertisement and made fun of that advertisement, let me see if I can get these to advance now. Okay. And I have a blue screen. Hold on. Bear with me. Like I say, the nightmare is here. Okay. Let me go back here. Okay. There we go. Okay. Well, almost. It's not funny anymore, is what I'm trying to get you to see. I turned 60 this year. And so, okay, I'm just going to leave it that way. I turned 60 this year. And as many of you are aware, I say with this that, go backwards here, sorry. No, okay. That, again, we got into emergency medicine to save lives, and ground level falls are complex and often very difficult in managing so many factors that impact that. So in last year, I got the privilege of being asked to be a co-chair to the Utah Falls Prevention Alliance. And as Jamie so beautifully introduced, my cohort, Sally, was the prior co-chair, and then I've had this role for about a year now. Sally left very big shoes for me to fill. And again, like I say, I work at Intermountain Medical Center, and again, have that passion for reducing falls. Sally is a huge help for me when I have random questions and need help. And the objectives today were just to raise awareness to the Utah Falls Prevention Alliance, to their website, and I call it my website, my co-chair where with the Utah Falls Prevention, but to help bring awareness to that, to identify the CDC and the National Commission on Aging information on falls prevention, to discuss the current statistics for falls, and then resources for falls prevention. So bear with me one more time while I share this screen, hopefully will be what I want it to be. If I leave nothing more with you today, it's this information, and that is the website for not only falls prevention, but for the Commission on Aging. And prior to this role with the trauma outreach as a bedside ER nurse, I didn't even understand that this information existed. Truly, there's a beautiful Commission on Aging within the state of Utah. It's a great group, and they are very committed to aging in place and helping our elderly stay independent and have the resources that they need. And this is a beautiful website. Hopefully, we'll scroll up here. There's just amazing information on here. So please, in your notes, or remember that it's this Utah Commission on Aging, the ucoa.org is how you access that. And within this website, again, there are just so many resources on whether it's not, and they're not all falls related. It's just the aging services, aging issues, some of the volunteer centers, global gateways. This just has so much information on there. So to get to the information on falls prevention, there's two ways you can do that. You can either come into aging issues. There's issues on here. And then again, there's information on advanced care planning, caregiver and partnering, financial security, food security, health and wellness. And here we are under falls prevention. And you click on that, and that takes you to this website. Or you can come back out to the main page, go to the collaborative efforts, and then we're falls prevention here. So this is the Utah Falls Prevention Alliance website that, again, telling us you a little bit about the Aging Commission. It was formed in 2017. Sally was a huge part of that with Senator Iamoto. The group is composed of diverse stakeholders dedicated to reducing falls and fall injuries in Utah's older adult population. We work to increase public awareness of the steps older adults and their families can take to prevent falls, and the Alliance builds connections between our healthcare providers, emergency medical services, and health insurers to improve coordination of care. We meet monthly. There are representatives from the University of Utah, from Intermountain with me, with St. Mark's, with the Department of Health. There are several healthcare agencies. Select Health is represented there, Optum, the University of Utah, senior clinics. And so that the group of us meet and discuss what we can do to help connect the dots for resources for our seniors. And that information is shared, a lot of that here within this website, learning more on exercise, home safety, outdoor safety, and medication management. One thing, the bottom part of this is what I really want to bring to your awareness as well. There's information here on how to access some of the programs that are available. This will take you to the Live Well website, which Sally will go into more of that. This is how you actually get in and look for those classes that are available. Again, this is run by the Utah state, so there's not just falls, there's suicide prevention, traumatic brain injury, car seat, and that type of information. But if you come in here and you select stepping on, that will bring you back out to the programs that are available. You further that by looking to see where you live, and the classes and those resources are on there. So that is that website. And then let me get back. Are there any questions currently right now on how to access this website? Because that to me is the most important information I'm sharing with you today, is to get into this website. And then no questions, I'll keep going. It's out there in the virtual world that I hope you're, don't have those. Anyway, I also wanted to bring to your attention the CDC website, which is another great resource for information. When I first, within the injury prevention and trauma, or the outreach position that I hold at Intermountain, I am driven by mechanisms of trauma. And obviously our number one mechanism of trauma is adult elderly falls. And so when I took the position, of course, that was first and foremost on my list. Well, again, it is a huge undertaking to try to even connect the resources within my own organization. But if you come out to the CDC website, you will find all kinds of great information that will help you even begin a program within your own institution. And also for you personally, if you have someone who is struggling with independence or frequent falls. One thing I wanted to bring to your attention was the My Mobility Plan. I love this document. It's bright, it's colorful, you can order it. They send you, it's about 25, so I have to order it frequently, but I try to remember to do that. But this again follows everything in the STEADY. The CDC promotes the STEADY program, which is stopping elderly accident deaths and injuries. It talks about staying independent, things that you can do within your home, discussing medications with your physician. Have you gotten a recent eye exam? Home checks. And then again, how are you going to get around in your neighborhood? And I just like it because it's just colorful and bright. So just know that that is a resource. And then again, within the CDC website itself, there is just a ton of information on staying active and staying healthy. So if you go into that CDC website, which I cannot access right at the moment. Here we go. Come back where I started. Okay, fall facts. And then within here, there's also fall data. You can scroll here by state. You can look and see. It'll bring up a picture of the state. You hover over us, and we're about 26 to 28.7, right within that national average. But also, you can look at the cost of falls. I think most of us know about that, but that information is on this website as well. And then finally, one other one is I just want to bring attention to you for the National Council on Aging. This is a federal site, and this information here is also one that is just a huge resource, again, for falls prevention for older adults. You can talk about facts on it, debunking the myths, falls and prevention. And the one thing that they rolled out just recently, probably within the last 6 months, is to see if you're at a risk for a fall. I actually took this. I'm happy to report that even though I have a few factors, that I'm not a falls risk yet, but this is something that maybe you could sit down and have that conversation with a family member or a neighbor or whatever, which is a kind of a non-threatening manner to look at them and see, hey, maybe you are at a risk for a fall. So those are some of the websites that I wanted to share, mainly going back again. I have to promote one more time back to the Utah Commission on Aging. And again, this is just such a rich and resource for you to be able to access resources for falls prevention. So, see if I can get back to my PowerPoint one more time. To go down, we talked about the CDC and last picture. So this sweet little lady, I was with her on Saturday, is my mother-in-law. She is 81 years old. She currently is in memory care, which I laugh. I love this picture because if you look, she's holding about 10 pairs of glasses in her hands. And I literally can take those to her and I go back in a week and they're gone. I'm sure they get shared with the other residents. But luckily, this sweet little lady is pretty healthy physically. She's not a huge falls risk, except for most of the times when I go visit her, she's dressed and has no shoes on. So I just wanted to bring, like I say, that it's a very personal subject for me in making sure that she has the resources that she needs as well. Again, and this was just discussing going back to that website where you can actually access the data if you're interested in that, or if you need to promote or get the attention of your administrative leaders or whoever, that data is on that website to bring to their attention. So are there any questions for my presentation before I turn it over to Sally? I so appreciate all they do for anything with emergency medicine. And I do laugh because when I teach my Stop the Bleed classes, and I'll ask the participants in those classes, what do you think our #1 mechanism of trauma is? And most of them will say, oh, it has to be gunshot wounds, or, oh, it has to be, motor vehicle accidents or whatever. And often, probably 99% of the time, they're a little bit surprised that yes, our #1 mechanism of trauma are ground level falls in our elderly population. And unfortunately, what we see is that first time fall may involve a fractured hip. The second time fall is pretty high percentage that's going to be a head injury of some sort. And so trying to get those resources in place before that accident, before that injury is a huge goal of what we are trying to do. We do currently have hopefully a document headed to the governor's office today that will declare tomorrow is our Utah Falls Prevention Day. So please, have that conversation. Hopefully have that conversation prior to the fall is what our goal would be. And if there is any, if you want to participate or have information that will help us as the Alliance to get better resources out to our seniors, please feel free to reach out to me. I'm more than happy to share information that I have learned, or if we can take information back to that Alliance for you, it would be great. So Sally, I will turn it over to you. My anxiety level for my technology has gone down to nothing now. So yeah, thank you, Sally. I'm going to sit back and enjoy your information.
All right. Cool. So thank you, Jamie and Teresa, for asking me to be part of this presentation. I'm going to talk about resources and information available through the Department of Health and some other community agencies. And then I'll end with just a brief description of our current work with EMS agencies and other stakeholders. So this map shows the 61 small areas in Utah. Red indicates fall hospitalization rates that are higher than the state average. Yellow is the same as the state average, and blue is lower than state average. So you can see the red areas are all kind of along the Wasatch Front. The most northern area is Kaysville and Syracuse. Down in the south, it's North Provo and BYU. And then the other areas are all in Salt Lake County. 68% of falls occur in the home. And that like really surprised me because it's people who are living independently and they're not in long-term care. They're not in healthcare facilities or other institutions. So yeah, that's something that we, can really hopefully have an impact on and reduce those falls in the home. Up to 30% of people who have a fall suffer injuries that significantly impact the quality of their life. And we know that when an older adult falls, he or she becomes fearful of having another fall. Their confidence to perform activities decreases. And a common response then is to reduce activity, which then leads to reduced mobility, loss of physical fitness and function. In addition, if a person restricts their activity and isn't going out as much, they become isolated, which is detrimental to health and well-being. We know that older adults who stay actively socially engaged live longer and healthier lives. So some risk factors for falls, we can't change. We can't change our age. We can't change pre-existing conditions or comorbidities such as Parkinson's or multiple sclerosis or dementia. But there are risk factors that are modifiable, such as improving strength, balance, gait, vision, activity levels. We can reduce risky behaviors such as climbing on ladders and reaching up to clean out leaves and gutters. And we can address environmental factors such as lighting, walking surfaces, railings and grab bars. And then medications, some medications are really are highly associated with fall risks. So there are antidepressants, anti-anxiety, hypnotics, and antipsychotic medications. Ambrose in 2013 found that psychotropic medications increased fall risk by 47%. Dr. Mary Tinetti at Yale was one of the first early researchers studying older adult falls and fall prevention. And this chart is from her work. And obviously, the more risk factors a person has, the more likely they're to fall. But one risk factor, an older adult has less than 10% chance of having a fall each year. 4 or more risk factors, there's almost an 80% chance of having a fall. And if we think about it, like we see people in the clinic that have multiple risk factors. For example, someone with diabetes may have impaired vision, decreased foot sensation that affects their balance and gait, decreased muscle strength, and they may be taking like an anti-anxiety medication or even self-medicating with Benadryl to help them sleep. This next chart shows the trans-theoretical model of health behavior change. It's important, like before we start talking with our patients about what they can do to prevent falls, to assess what stage the patient is at in regards to making health behavior change. So the pre-contemplation phase, they would say something like, "Oh, it's just an accident. I'm going to be more careful." And your response could be like, "Well, being careful is really a good idea, but it's usually not enough to keep you from having another fall. Here are some things that you might do." And you could give them a little handout and just see if they look at it, bring the topic up again next time they visit. In the contemplation phase, people are thinking about it. They're kind of weighing the benefits and the barriers. So they might say something like, "I like to exercise, but I don't, but I'm afraid of getting too tired." And this is your opportunity to really talk positively about making changes. For example, like you really, you don't have to exert yourself to benefit from exercise. You can be done in as little as 15 minutes 3 times a week. And then the preparation phase, thinking about they're thinking about making a change, and they're also worried about falling again. So you can sense this, like they're taking a step forward, and they might ask, like, is there anything I can do to prevent falls? So you might give them one suggestion and give them some information and say, hey, just take this home and, talk it over with your spouse, and we'll talk about it again. And then there's the action phase, and that's when they're really ready to take steps. And this is the fun part, where you get to really engage with the patient, figure out a plan, follow up on it. You could see some neat changes happening. I put this picture in of community clinical linkages as a reminder that as healthcare providers, we are really not the only resource for patients. It's important to take time to know about community resources, public resources in the community, and to help patients connect with these resources in order to get the best results. There are lots of options for fall prevention programs. And I used to get asked by primary care providers all the time, like, which program is best for my patient? And then I found this chart that Dr. Jane Mahoney from Madison, Wisconsin put together. And so you can see at the bottom of the pyramid, those are the people who are cognitively intact, have few balance problems. And for those folks, like, a lot of regular exercise programs work, strength and balance classes, activities. If you find something that somebody likes, bowling, ping pong, badminton, pickleball, dancing. If you want something that's a more formal class, Tai Chi, enhanced fitness, which are both offered at senior centers, are a good option. Silver sneakers or Silver and Fit are often available at gyms. If we go to the next level, these are people with mild to moderate balance problems and a history of falls or a fear of falling. They're still cognitively intact. And those are the folks that are appropriate for stepping on. I'm going to go into a little bit more detail about stepping on in a minute. And then at the top of the pyramid, you see people with moderate to severe balance problems. They may be homebound, may be cognitively impaired, and they need some more one-on-one attention with physical therapy, maybe occupational therapy, until they get a little bit higher level of independence. So stepping on is a great evidence-based fall prevention program. And it's, in Salt Lake, it's currently being offered by Salt Lake County Aging and Adult Services in several of the senior centers. So it's a 7-week class, and it focuses on this 6 steps to reduce falls that are recommended by the Council on Aging that you saw in Teresa's slide. It was researched and developed in Australia and has been shown to have a 31% reduction in falls. It really works because it empowers older adults to make changes in their lives that will reduce the risk of future falls. So participants learn, not only from the class leader, but they learn from each other, which is a really powerful way of learning to make changes. Health professionals teach parts of the class. So a physical therapist comes in 3 times to teach the balance and strengthening exercises. A pharmacist talks about medications and fall risk, and an optometrist discusses the role vision plays in falls. So when I was at the health department and implementing stepping on throughout the state, I looked at the data from the first 370 stepping on participant surveys. So these are our core demographics. 75% of the people were ages 70 to 89, 80% were female, 45% lived alone, 92% said they had a fear of falling, and a third of the participants had fallen in the last 3 months. So, and 47% said they had limited their physical activity due to health conditions. So except for the ratio of male to female participants being too low, we were really getting at the target population for stepping on. And then I looked at the post-program surveys that we asked people to complete. So 96% of people said they were more comfortable increasing physical activity. And this is super good because it indicates that people maybe, taking a step to break that negative cycle of negative consequences once they've had a fall. 98% of people were more comfortable talking to their healthcare provider about falls. This is important because our data shows that, in general, primary care providers are not doing a great job at screening people for future risk of falls. But if a patient brings it up, then they're more likely to do an assessment and make recommended interventions to reduce fall risk. And then we also asked people, what steps they had taken during the 7-week class to reduce falls. So I was pretty happy with this because 55% said they'd already talked to a family member, 65% made changes in their home, 95% were doing the exercises, and then we had like between 20 and 30% of the people had talked to a healthcare provider, had their medications checked, or had their vision checked. That low bar is only 8% of people had attended another falls prevention program at the same time they were taking Stepping On. And this is what Teresa showed you on the Falls Prevention Alliance website, where you can go and look at how to take a falls prevention class. If you can search by, if you click on Stepping On class schedule, then you can put in a zip code and you'll get a list of current classes that are being offered. So you can actually register online, or this is kind of cool, you can actually call that number at the top, 888-222-2542, and talk to someone at the health department. It's the resource line. There's people that will answer the phone and guide someone through the registration process and get them enrolled in a class. So we try to really make this as easy as possible. Home modifications, just to talk about these for a few minutes. Gillespie did a Cochrane review in 2012 and found that they are definitely effective at reducing the rate of falls and reducing the risk of falls. And they're most effective for people who are at higher risk of falls. And then AARP did a survey of 2,000 of their members. Over 90% of people in the survey, 65 and older, said they want to stay where they're living as long as possible. And even if they need help caring for themselves, 82% would prefer not to move from their current home. So this chart shows, why older adults don't want to make home modifications. And it's not really that they don't want to make the changes, it's just that they really need some assistance in making those changes. So maybe they need some either physical or financial assistance. They need some dependable, trusted recommendations for contractors, or maybe some instructions for how to do it. So I think if we want to help people age in place, we need to address these concerns and assist individuals in remaining in their homes. 211, I think most of you probably know this, but it's the resource line. It's operated by United Way, connects individuals looking for health and human services to resources in their community. So if you go to 211's website and you click on housing and utilities, from there you can go to home repair and weatherization, and you'll find a list of people in your zip code that offer these services. So in Salt Lake County, this list of agencies includes ASSIST, the Community Development Corporation of Utah, Salt Lake County Aging and Adult Services, Salt Lake Valley Habitat for Humanity. And by the way, our local Habitat has a really robust home repair and remodel division. They're not just building new homes. And any of these agencies will help to pull in other agencies for funding and braid that funding together to get as much bang for their buck. So I'm just going to finish up talking about the Center for Clinical and Translational Science grant that we received about 2 years ago. And Thackeray from the University of Utah's physical therapy program is the lead researcher. So our aims for the grant were to analyze non-transport 911 data in Salt Lake City, interview older adults who had a fall, and then develop a care plan or develop a plan, sorry, for just to move forward with a new program to reduce repeat 911 calls. So when we looked at the data, we analyzed 911 calls for falls for individuals 65 and older over an 18-month period of time. We could look at them geographically where they were, where most of the falls took place. But of the 1,300 calls, 53% were not transported to the emergency department, and 28% were repeat calls. Half of the calls were to single-family residences, and a third were to apartments or townhouses. And of those multi-unit residences, most of them were subsidized housing. In our patient interviews, what we found are that patients are really acting as their own case managers, and they're choosing the resources that they believe help them best. And the problem with this is twofold. One, adults over 65 really tend to overestimate their independence. And then second, they really may not know all of the resources that are available to them, and may need help in making decisions on how to reach out to those resources and which ones to contact. And a lot of the times, the person who has experienced a fall really perceives it as a threat to their independence. I think we're all aware of that. But it really puts us at odds as healthcare providers, because the patient really wants to just stay at home, and the healthcare provider wants to find a way to prevent falls. So it's important that we find a way to help reduce that perceived threat and connect individuals with resources before they continue down that slippery slope of having more falls and injurious falls. At the bottom is a quote from the therapist who did the interviews, and I think this is great. "We want to help the faller move the football toward the end zone of independence." Kind of it's a nice quote, especially appropriate since football season is starting. We had some stakeholder meetings with Medicare Advantage, with representatives from Medicare Advantage plans, government agencies, community services, healthcare providers, and the older adult community. In summary, the program that we developed has to have be of no cost to participants, happen in the home, but it really needs to last longer than the current home health services without the restrictions of homebound status. We need to build trust with participants, have it be patient-directed, and address function and mobility. And of course, we need to include home modifications and work on building our community clinical linkages. This is just a very preliminary outline of what a program could look like. And we just threw the name Thrive for the program up there. It's not necessarily going to be the name of the program, but people who fall and call 911 and are not transported, or go to the emergency room and then are sent home, will be connected to a guide. That guide will contact people, and those who don't qualify or decline to be in the study will get usual care. And of the ones who do qualify, we'd like to do a comparison of usual care versus intervention. So usual care would be linking that person to their case manager or primary care provider, providing education about falls prevention, and a link to the Falls Prevention Alliance website. Intervention would include usual care, plus a program that addresses mobility, home safety, care coordination and lasts at least 6 months. So this is where I'm done with my presentation, and just wondered if anybody has any questions. All right, well, I'm going to stop sharing then and turn this back to Teresa.
So I just have to share with you, I had the opportunity prior to, our lives prior to COVID. Well, we had just kind of entered into COVID, and I had a stepping on class. I had 5, and obviously they're all older women, 65, 70-year-olds that would come to this class. And the classes, again, the stepping on class is designed with different presenters. And in honor of my EMS partners, I have to tell you, it was so funny when we did the community safety, Murray Fire. I had a couple of retired firefighters come in and teach that class for me. And those little ladies ate that up. So it's kind of like, okay, if the fireman tells you to wear better shoes, you're going to do that, or you're going to talk to him about that versus talking to your doctor. And it made me chuckle how funny that was with, I always would tell my kids, maybe I should have your school teacher tell you to clean your room and then you'll do it versus mom telling you. But I would just really encourage you tomorrow, especially as we look at that National Day for Falls Prevention, to really reach out to someone that might be in that position of needing a little bit more assistance, or that you, in that non-threatening manner, as a friend or as a firefighter or as someone in your church group or whatever, can have that discussion with them, that maybe they are a little bit hesitant to talk to their physicians about that, but that they will have that conversation with you. So really encourage them to either talk to their physician, or I always send it back to their family members, or a trusted friend or someone who can help them. Because if we can somehow, really try to get that, um, Dr. Joy that I work with, our falls prevention, says, to keep the horse in the barn before we let that horse out of the barn and the fall has occurred, that if we can put those measures in place to help them not have that fall, that is a huge advantage in keeping them safe and keeping them at home. And again, I classify myself in that category. I have to live into that. Do I have a fear of falling? Not on maybe on a typical day, but yes, I am afraid of falling. And so, putting those proper measures in place to prevent that fall. I just also wanted to share with you that I started the conversations about falls prevention, and again, connecting the resources within Intermountain Medical, within Intermountain Healthcare, over a year and a half ago, and that conversation is still in progress. So I think that's my frustration with whether being an ER nurse or however, is that I want it fixed now, and falls prevention is not a fix now, it's a fix slowly and hopefully get the right measures in place. We do discuss in the Falls Prevention Alliance meetings on how we can best make that connection between, again, getting resources to people in the home. That's a discussion currently, as far as especially helping the EMS providers that are out on those non-transport calls, to know how best to get the resources to the person that is having those repeated falls. Again, unfortunately, there's such a huge component of self-determination. They have to want to make changes. We can't do things for them per se, but at least to try to get those resources to them. So again, I just wanted to stress, please look at the Utah Commission on Aging website. There are connections on there for pretty much anything aging. There's a link to the veterans benefits. There's, again, the link to the falls prevention information. There's all kinds of good information. And if you can see, hey, I see something missing on there that could be on there, please reach out to me. Because that's always kind of an in-motion website that we're adding to and changing and putting things on there as we become aware of resources. So I'm going to attempt one more technology. Here we go. Just with a final parting slide. And hopefully just play for me. That's all I ask. Let me see if I go back up here.
Hey, be careful. You might think you're never going to fall, but we all know someone who has, don't we? Next time, it could be you. The good news is most falls are preventable. Start with 6 easy steps. First, find a balance or exercise program to help you build stability, strength, and flexibility. Make it fun and go with a friend. Don't be afraid to tell your doctor if you've had a fall or are afraid of falling. Ask her to assess your risk of falling. Discuss medications with your pharmacist or doctor. They'll know what prescriptions and over-the-counter medications can increase your risk of falling. Make sure you get your vision and hearing checked every year because your eyes and ears are key to keeping you on your feet. Keep your home safe. For example, remove any items you might trip over. Make sure your home is well lit. Use bath mats in your shower and install grab bars in the bathroom. And finally, remember, it's important to talk to your family. Ask for their support in taking these simple steps to stay safe. Falls are not a normal part of aging. But every 13 seconds, an older adult visits an emergency room for a fall-related injury. Luckily, you can take steps to reduce your risk. Visit ncoa.org/falls prevention to learn more.
Oh, Teresa, we can't hear you.
Oh, it's
There we
because I put
go.
myself on mute. I say I'm done with technology for the day. I'm gonna go
Okay.
back. I have to even remind my marketing people. I'm a nurse for Pete's sake. I'm not. Yeah, anyway, but thanks for your patience with that. And I hope this was helpful. Again, to be able to know that there are resources available. And please reach out to me if there's anything you can see that I am missing or that as the alliance that we can add or change. If I had it in my perfect world, I would love to see, legislation that would at least offer some seniors maybe some financial support for modifications or that type of thing. I know Optum and the Advantage plans with Select Health do offer those little bonuses to have X amount of dollars that are put towards home modifications and that type of thing. But if there's anything that you can see again that maybe we're missing or can do better, please reach out to me and see if we can make some good things happen with falls prevention. Are there any questions? Please, somebody throw me one so I know you're listening out there. Okay, I'm going to assume we covered everything and you don't have any questions, which makes me feel better that, okay, maybe we're okay. But please, again, know that you can reach out to me if there's anything that we can do to change or make things better in falls prevention. And again, have that conversation tomorrow with someone that might benefit from the falls prevention initiatives or things that you can encourage them to do to prevent that fall. Okay, Jamie, it's back to you. I'm done. I'm gonna go
Oh,
I don't know.
Thank you so much. For our emails folks, I see there's multiple people in the room. So if you guys each want an individual completion certificate for contact hours, put your email in the chat or email me directly and I'll get those to you. I want to thank you, Teresa and Sally. I did have one of our registrars pull our numbers. So from July 2020 to the end of June in 2021, the University of Utah specifically had 811 falls and 439 of those were older than 65. So the age range for us is between 18 to 97 when we pulled those. So I know that group, just over half, we can have a big impact on and be able to, I think, help them, give them resources for healthcare providers, seeing them in the emergency department, starting that conversation even with the emergency doc to get referrals. And then as EMSs are coming in the room or responding to homes, being able to see these risks and helping them out. I know my grandmother does not want to move from home. And she recently has had to undergo some physical therapy at home. And she's like, man, I'm just tired. They're working me to death. And she's almost 90, doesn't live alone, but she still lives in her home. So we're always cognizant of making sure that she doesn't have any trip hazards in her house. And again, throw out, like I said, if you guys have any questions, throw it out there. The poll is up and running. So once you're done with that, let us know. And tomorrow is the National Day for Falls Prevention. So we'll be pushing more information out. Like I'm sure all of us have our social media sites. I know I'll be pushing it out on our social media, just different links and things that you guys can do. So any questions, concerns, anything that we missed, or any resources you guys want to share with us, please jump in and do that. It's a quiet group out there today.
I know. And again, Jamie, it's a complex issue. It really is.
Yes.
It's not like I fell and I need stitches. It's like I fell and there are so many moving pieces to that. So yeah, please again feel free to reach out to me if I can clarify or help you better understand some of those resources that are available. I'm more than happy to share. I'd rather answer an email than you waste hours and hours trying to figure something out that probably I've already, had that conversation or touched on that conversation. So I'm happy to do that.